Welcome, everyone. Thanks for joining us today. My name is Emily Kurth, and as the other Emily just told you, I am primarily responsible for email marketing and content creation here at Realityworks. And that job lets me connect often with educators across the country to learn what they're doing in their classrooms and how they're successfully engaging their students. And that is where many of the trends and tricks I'm about to share from you have come. I've learned them from instructors, administrators, and other subject matter experts over the years. So over the next half an hour or so, we'll discuss a variety of topics. We will start with a quick overview of Realityworks for those of you who aren't familiar with our company. Then we'll talk about today's students and the characteristics that make them unique and that are spurring changes in teaching methods. Then we'll discuss the need for geriatric sensitivity and dive into some teaching strategies you can use to engage your students and help them develop those important empathy and sensitivity skills. We'll wrap things up by sharing some unique simulators and models that Realityworks offers that can help you address these key skills, and then we'll have time for questions. So with that, let's get started. What is Realityworks? Well, we are an employee-owned company based in Eau Claire, Wisconsin, and we create experiential learning tools for helping instructors teach job and life skills. We actually started over 20 years ago when former NASA engineer Rick Germain created the very first RealCare baby infant simulator, and then went on to found the company that's now Realityworks. And today, we're proud that our learning solutions are in more than 70% of US school districts and programs, and in more than 90 countries around the world. Baby is still around, but now you can look to us for all sorts of other fun hands-on learning aids, like a bovine birthing and ultrasound simulator, an ECG simulator, virtual reality welding simulators, and of course, tools for teaching geriatric sensitivity. Now, everything we offer is wrapped with curriculum, student activities, and assessments, and we really try hard to provide learning aids that support instructors' efforts in the classroom. That is a need that's come directly from conversations with educators, which are really the fuel for all of our products. None of our tools would exist without those partnerships. We strive to collaborate with teachers and listen to their needs so we can create tools that really help them do their jobs better. And in fact, those conversations are what led to the creation of our very first training tool focused specifically on geriatric sensitivity a few years ago, which is our geriatric simulator. Now, I'll talk about that learning aid a little more in detail later in the presentation, but I do think it's a wonderful example of how we strove to create learning aids that really met the needs of teachers. And in this case, helped teachers develop empathy and sensitivity in their health science students. To ensure we're on the right track, we are constantly seeking out these opportunities to speak with educators and find out what they're doing. And again, those conversations are where a lot of the tips and tricks that I'm about to present came from. So that said, let's dive into teaching geriatric sensitivity in a post-pandemic world, tips for engaging future healthcare professionals. So let's start things off by reviewing the faces of CTE today. Who are our students? Well, today's students are digital natives. This is a term often used to describe today's students, most of whom were born after 1997 and are therefore members of the post-millennial Generation Z. The oldest are in their mid-20s and the youngest are about the age of my oldest child, 8. They are considered digital natives because they grew up with technology. They've never known a world without social media. Now, this, as it compares to millennials, is different because millennials are considered digital pioneers. They weren't born in a world with social media, but they bore witness to that explosion of technology and social media, whereas Generation Z, has never known a world without information being immediately accessible on those devices, and where social media is the norm. Now, according to a 2020 Census Bureau survey, about 67 million Americans belong to Generation Z, and the needs of all those Gen Z students are changing the way that you teach. For instance, the standard classroom model where an educator stands in front of the class and lectures doesn't work for these students. They want to learn and succeed, but they will disengage with the discussion if they don't feel connected or if they don't see the relevance. Generation Z students want to succeed, but they want to know why they're learning. They want to know how they'll apply to the real world. That relevance is super important to Generation Z learners. Now, again, these students are different than millennials. Compared to millennials, Generation Z students have even shorter attention spans. They have even better technology skills, and they have an even stronger desire for real world learning. They read less than 20% of text. These are students who are accustomed to immediate feedback. Again, there's that word relevance. More than ever before, these students want to see the relevancy of what they're learning. Really, for all intents and purposes, you're basically teaching Goldfish. After all, the average attention span for the notoriously ill-focused goldfish is 9 seconds. And according to a 2016 study from Microsoft, people now generally lose concentration after 8 seconds. Researchers say this is an indication of the effects of an increasingly digitalized lifestyle on the brain. Now, there are some who claim that this goldfish myth has been debunked and that goldfish actually have quite impressive attention spans. But I think the point remains the same. Today's students' shorter attention spans mean active learning opportunities, hands-on learning opportunities are essential. So if you subscribe to the goldfish myth, the question now is, as educators, how do you work with goldfish? While it introduces some challenges, it also creates some significant opportunities. So we've spoken to educators and conducted research on this topic, and we've found that there are steps you can take to engage today's digital native students. Start by getting rid of the 50-minute PowerPoints, which is a tip I love sharing in a 45-minute PowerPoint presentation. After all, we can't get rid of PowerPoint presentations completely. They are useful, but if you have to use them, incorporate quizzes, activities, and hands-on demos every few slides. Give your students more than just the textbook or a slide. Add in that group work, add in activities. Seek out project-based learning opportunities like internships. And of course, provide interactive hands-on learning opportunities. We've heard this overwhelmingly from educators. Today's students are used to having something in their hands, whether it's a fidget spinner or a cell phone. If you can put an awesome hands-on learning tool in the place of one of those other gadgets, they're going to pay more attention. Now, another key to engaging today's digital native students, focus on soft skills. This comes right from industry. A widening gap is being noticed between the expectation of companies during the employment process and the performance of job applicants in the area of soft skills. In 2019, CNBC listed the 10 most in-demand skills of that year, and 5 of them were soft skills: time management, adaptability, persuasion, creativity. So this was before the pandemic. Now, last month, career site Zeti updated their top 10 skills recruiters and hiring managers were looking for, and those are listed on your screen in front of you. As you can see, problem solving, communication, soft skills remain among the top. And in healthcare, this is even more important. Since 2012, the Centers for Medicare and Medicaid Services have been withholding hospitals' Medicare reimbursement based on their quality performance, and 30% of that decision is determined by customer satisfaction. Soft skills, of course, are an important driver of that customer satisfaction, as anyone who's ever visited a healthcare professional knows. So now let's focus on geriatric sensitivity in particular. So, what is a geriatric care skill? What is geriatric sensitivity? Well, we know that the aging baby boomer generation has created a variety of geriatric careers, opportunities in senior care facilities, hospitals, assisted living facilities are just a few examples. And we know that elderly patients have unique challenges and needs that require special nursing skills like communication, patience, critical thinking, mental flexibility. On your screen now is a list of the top 10 skills that you need to work in a nursing home. And as you can see, most of them involve direct patient care. Geriatric sensitivity has become a key skill for anyone entering the healthcare field. So there are a few key trends happening at once right now. One, older Americans are retiring in droves. Research by the Pew Research Center conducted just last month revealed that as of the third quarter of 2021, 50% of US adults ages 55 and older have said they were out of the labor force due to retirement. And in the third quarter of 2019, before the onset of the pandemic, 48% of those adults were retired. The second thing that's happening right now is demand for healthcare jobs is growing. Healthcare professionals, of course, have played a critical role throughout the ongoing coronavirus pandemic, and demand for them isn't expected to slow down anytime soon. The Bureau of Labor Statistics reports that employment in the healthcare field is projected to grow 16% over the next decade. Healthcare will add about 2.6 million new jobs to the economy, the most of any other field. And this growth, according to the Bureau of Labor Statistics, is mainly due to an aging population that will have a greater need for healthcare services. So where does that leave us? Well, we have a growing aging population, plus enormous growth of occupations related to the care of older adults. And we have a generation of students who employers say struggle with soft skills like empathy, which, as you know, is absolutely a requirement of providing quality care for aging populations. Now, I love this quote. Miranda Kessler is an instructor at a career and technical education center in West Virginia, and she uses our geriatric simulator in her health science program. This statement from her mirrors that of many other healthcare instructors we've spoken to. Big takeaway here, compassion and understanding are key to providing care for geriatric patients. If you walk in the shoes of an older adult, you're much more likely to provide more appropriate care because you'll understand the challenges that daily tasks can present. Now, here's a fun takeaway that we like to share. One instructor we worked with shared this acronym with us, and we thought it was a handy tool that might help your students not only remember why empathy is impactful, but how to demonstrate it to their patients. So this is a fun one that you can print after today's presentation and help your students get used to empathizing with their patients. So on that note, let's talk about now some specific strategies that you can use to teach geriatric sensitivity to your students today. Strategy number 1, find out what works. This recommendation comes directly from a nurse educator here in Wisconsin who's been teaching geriatrics for about 25 years. Now, she told me that for years and years, she used in-class cues like body language and eye contact to decipher her students' learning styles as she taught them. And then it occurred to her one day to just ask before she even began teaching them. Now she welcomes each new class of CNA students with a questionnaire about their learning styles, and then she uses their answers to help her learn about them before they even start things like clinicals, so she can align their needs to what she has to share with them. One example she told me of this practice is that she had learned after distributing a questionnaire and collecting their results that most of her students in that particular course were kinesthetic learners. So she really tried hard to incorporate simple hands-on activities whenever possible. And that's where the photo on your screen comes from. She incorporated hands-on massage to each other, just a little 5 or 10-minute activity right after they were done completing a lesson on the topic. So that was her way of incorporating a hands-on activity, breaking up that PowerPoint presentation, breaking up the textbook learning with a simple hands-on activity that really ensured that her students continue to be engaged in the lesson. Now, you can do this right away if you'd like. If you do a quick Google search, you can find all sorts of free quizzes that you can use to send to your students in the beginning of each semester. These are 3 that we found right away. You can create your own self-assessments, and of course, I'm sure there are more out there as well. But these are great tools you can use to collect information on your students that will help you configure curriculum that really speaks to their learning needs. Strategy number 2 is to set the stage with a pre-activity. We recommend using an introductory or icebreaker activity to introduce the concept of empathy in a simple way. Now, instructors who use our geriatric simulator, for instance, get the empathy self-assessment that you see on your screen with their curriculum. It's a great way to kick off the lesson as it gets your students thinking about their own empathy levels right from the beginning. Now, you are able to download this empathy self-assessment for free, even if you don't have the simulator. Hop online to the URL on your screen now and download our free social emotional learning guide. That guide has 4 or 5 different activities and resources for helping students develop those social emotional learning skills. And one of the downloads in that guide is this assessment. So this is something you can start using right away if you'd like. Other icebreaker activities that you can use to address empathy and sensitivity in your students are partner interviews by pairing students up to interview each other, then introducing each other to the class. You're encouraging teamwork, which is vital in healthcare settings. You could also create a geriatric sensitivity specific empathy ball, write some questions related to empathy and sensitivity on the sides, have your students stand in a circle or other like configuration, and just toss the ball back and forth. And whoever catches it has to answer a question such as, how can body language be used to express how you feel? How did you cope when you were feeling frustrated in front of a patient recently, etc. Ask questions that relate to empathy and really encourage your students to be vulnerable when answering. Start those discussion activities. Another thing you can do is to ask your students to describe a time that they were empathetic. Now, this will be even more valuable if your students can pick a time specifically related to healthcare, but even if it's not, if it's from a moment they were at the grocery store, it'll still help your students start to see how even small actions can be so important. Now, another strategy we recommend is to add relevancy with real world examples. Again, there's that relevance word again. This will really help your students engage with what they're learning and connect the contents to their own futures. This tip comes from a Louisiana CTE teacher, Jennifer Ebert, who I spoke with recently about the learning aids that she uses in her classroom. She likes to incorporate those real world examples whenever possible into her classes. And she did this during the pandemic online. She conducted these exercises via Zoom. She also sometimes had her students create PowerPoint slides illustrating their example. And once her students got back into the classroom, she just has them go around the room and stand up and share a time that they used a soft skill recently, whether it was from their job or athletic activity, along with a time that they felt that skill made a difference. Again, these examples are particularly helpful if they come from students who have part-time jobs as CNAs or other healthcare professionals. But even hearing how empathy helps students relate to a customer at their job serving fast food will get them thinking about how these skills apply to the real world. Our next strategy is to bring in subject matter experts. Try to find a local nursing home director, a certified nursing assistant in town, a dietitian, even an activities director, and other professional that works every day with older patients. Schedule whether it's a one-on-one interview or a one-on-one small group interview. These conversations will be engaging. They'll help your students see how the skills they're learning here in the classroom now actually apply to the real world. We recommend having your students come up with a list of questions they'd like to ask to really ensure that they're engaged during the interview. And of course, make time for post-panel reflection. And really remember that industry representatives want to help. Part of my job is interviewing professionals who help out in classrooms. And really, I have yet to contact a professional who, even in a small way, finds it annoying or hard to incorporate classroom help into their busy schedules. They want today's students to succeed because today's students are their future employees. Now, strategy number 5 is to incorporate hands-on learning aids. Of course, here at Realityworks, we want to make sure that teachers like you have the tools you need to create engaging learning environments that will foster healthcare career exploration and help your students develop those in-demand job skills. One way to do that is to bring some cool tools into your classroom. Bring in learning aids that engage your students, provide those hands-on learning experiences, and give them real-life practice. And research, of course, backs up the effectiveness of these kinds of training tools. These numbers are from a study at Julius Maximilian University in Würzburg on the effectiveness of age simulation. And this study found that 83% of participants who used an age simulation suit were able to empathize with life in old age very well, while 95% of participants had a better understanding of the physical conditions of aging after wearing an age simulation suit. And of course, especially as we're still dealing with a pandemic in many parts of the country, these days simulation can be an essential component of your program, especially if face-to-face interaction with real patients is not possible. So on that note, let's chat a little bit about some cool tools Realityworks offers that will really help you give your students the real life experience of the common conditions of aging. So on your screen now is the tool that started it all. You've heard me talk about it a few times in this presentation already, the Real Care Geriatric Simulator. This again was the first product that we created to help instructors address geriatric sensitivity. This suit enables the wearer to experience physical challenges of aging, like restricted range of motion, stooped posture, joint stiffness, difficulty breathing, and it comes with visual impairment glasses that simulate common visual impairments like glaucoma and cataracts. And what's really particularly cool about this simulator is that it comes with comprehensive curriculum. It includes 9 lessons on topics ranging from geriatrics and gerontology career exploration to visual impairment and declining mobility due to aging. This has been a really popular tool both in health science and family and consumer sciences programs. And again, it really enables the wearer to walk in the shoes of an older patient and experience the challenges that day-to-day activities present. Some other geriatric sensitivity favorites I like to include are our medication management simulation kit, which we created to help students understand the difficulty of managing medications and not only physically removing the caps to the pill bottles and counting out the right number of pills, but reading the medication if perhaps the patient has glaucoma or cataracts or something like that, and keeping track of the various medications they are supposed to take on a daily basis. We also offer a geriatric nursing mannequin, a geriatric sensory impairment kit, which includes a hearing simulator, an arthritis simulator, and other fun hands-on tools, as well as a hemiplegia simulator, a geriatric foot model, all sorts of fun hands-on resources that are designed to help today's health science students understand what it's like to be an older patient and develop that empathy and sensitivity. So we encourage you to hop on our website and take a peek at everything we have to offer, all of which was inspired by conversations with educators like you and, talking about the tools that you needed to help those students develop those important soft skills. Now, I did want to call out 2 new learning aids for teaching empathy and sensitivity. Both of the tools on your screen were developed just within the last year and are intended to help students develop, again, those soft skills. The first is an online program developing empathy for effective patient-focused care that lets students practice soft skills in the context of healthcare careers from any device that connects to the internet. So whether you're teaching in class or you're teaching remotely, students can log in and they'll be faced with interactive scenarios, videos, question and answer, et cetera, that help them hone those soft skills, especially in the context of healthcare careers. The second program I wanted to just highlight is a soft skills program specifically for caring for patients with intellectual disabilities, mental illness, or PTSD. That program uses a combination of hands-on simulators. We have one that simulates dementia and one that simulates auditory hallucinations. And then, of course, it includes curriculum, scenario cards, and workbooks that, again, is designed to introduce your students to caring for those diverse patient populations. So again, encourage you to hop online and take a peek at what we have to offer. You can try a free trial of our online Developing Empathy for Effective Patient-Focused Care program. And you can check out sample scenario cards and listen to that auditory hallucination simulator on our website. So highly recommend that you take a moment to do that. They're really, really pretty fun products. And that leads us to our final tip, create a geriatric sensitivity workshop. This tip is inspired by a Mineral Area College nursing program. This nursing program actually did this. They decided to dedicate one full clinical day to progressing students through a series of geriatric sensory stations. And they made the choice to do this. And you can read Sadania's story right on our website, but they made the choice to do this after seeing an uptick in older patients and realizing the importance of giving their students opportunities to practice caring for older patients and specifically honing skills like empathy and sensitivity. Now, with a geriatric sensitivity workshop, you can absolutely use ready-made simulators like the ones we just talked about, or you could create your own. And in fact, we do have a blog on our website that reviews 12 different wearable DIY simulations that you can create right away to help your students experience some of those common physical and common visual challenges and just get them thinking about what life is like as an older patient. So I highly recommend you check out that blog. It's got some great tips and tricks you can use to make your own simulations. All right, well, now what? Now that we've hit you with all of this great information, what can you do? We recommend visiting our website. You can download a free guide on teaching empathy toward older adults. You can access a free infographic on geriatric sensitivity. You can download that free empathy self-assessment I referenced earlier and more. And of course, contact us with any questions. We're happy to talk about your program, give you some ideas for implementing our own training tools or making your own. We can be reached via email, phone, or live chat. So with that, we will open it up to any questions anyone might have. Oops, it occurs to me I wasn't sharing that last screen. Here you go. We have this URL on your screen now, realityworks.com/geriatric training tools. Again, that's where you can get the guide, infographic, and all the other assets I just talked about. All right, with that, you can use the chat feature if you'd like to ask any questions.